other patient may not show any reaction. It depends on individual tolerance, which is a subjective factor with regards to pain perception and expression. For example, आप सब लोगों का अनुभव होगा, शायद ये किस्सा बताया कि नहीं मालूम नहीं, याद नहीं मुझे, लेकिन फिर से आपको बताता है. आप यदि छोटे बच्चे के डॉक्टर के पास जाते हो, पीडियाट्रिशियन के पास, या उनको वैक्सीनेशन करने के लिए जाते हो, तो आपने देखा होगा कि वो हॉस्पिटल में गए, बच्चे को लेके गए, तो एक आधा बच्चा जो आता है तो वो अंदर आता है, डॉक्टर बोलता है वैक्सीनेशन करने का, इंजेक्शन देने का है, तो वो बोलता है हाँ दे दो इंजेक्शन, कुछ गड़बड़ नहीं करता है. और दूसरा बच्चा रहता है, मोमेंट यू एंटर इनटू द हॉस्पिटल, वो पीडियाट्रिशियन के जो विजिट अपना वेटिंग लॉबी रहती है, वहां पे जाते वो भागने लगता है. जैसे उनका नंबर आता है, डॉक्टर बुलाता है अंदर, तो डॉक्टर का दरवाजा खुलता है, पेशेंट के माँ बाप आगे जाते हैं और बच्चा पीछे भाग जाता है. फिर आप उसको पकड़ के लेके आते हो, वो ऑपरेशन अपना एग्जामिनेशन टेबल पे सुलाते हैं, तो वो हाथ हिलाता है, पैर हिलाता है, फिर दो लोग हाथ पकड़ते हैं, दो लोग पैर पकड़ते हैं, इंजेक्शन देते हैं, और इतना गड़बड़ करता है कि इट इज वेरी डिफिकल्ट टू गिव द इंजेक्शन. अभी दोनों बच्चों का एज सेम, डॉक्टर सेम, देने का इंजेक्शन सेम, सुई भी 18 नंबर की 20 नंबर की सुई वापरने की वही
सर
सुई.
इंग्लिश, सर थोड़ा इंग्लिश.
Okay, both the patient, now the one child, both the children of the same age, they have come for injection to the pediatrician. Now one patient comes inside and say, yes, gives the injection. He shows the shoulder like that. And another child, moment you open the door, enters into the pediatrician's room, he starts running away. Then all the people, they will go and hold him, make him lie down on the examination table. Then two people will hold his both arms, two people will hold his leg, and doctor will give injection. And he will make such a hue and cry that whole of the consulting room will be taken on his head. Now, why this difference is there? The doctor is same, the injection needle is same, suppose 20 number, 22 number, same needle is used for both the children. But one child makes hue and cry and one child takes very quietly. Why? Because this is the pain perception of individuals. And this is not related. There is no measurement. We cannot measure that he is getting more pain and he is getting less pain. This is the brain which see that yes, I am getting more pain, and this is the phobia. So if the patient is there, how are you? I am fine. I am getting little pain. It is okay. I am managing it. But another patient, he will make the life of all the surrounding people miserable. Every now and then he will start calling, I am getting pain, call the doctor, give me painkiller, give me this injection. The pain will be same, but his tolerance level is less. Now this tolerance level can be improved by practicing meditation and yoga, so that at least his complaints will become less, and as because of his thought all the time, I'm getting pain, he's disturbed. When he's getting disturbed, his hypothalamus is activated and the cortisol levels are going up, and that is again causing problems. So pain management is very important. So palliation can be divided into three. It is very important in cancer patients. Immediately after diagnosis of the disease, make his mind sound and strong enough to face the disease boldly to get good results of the treatment, to improve the respiratory and cardiovascular system. So his oxygenation is better, heart is functioning properly. So during acute treatment, he fares better during surgery as respiratory system is improving. Now, whenever you give anesthesia to the patient for major surgery, I am also doing this experiment, because the patient who is going under major surgery, like the surgery which may be lasting for 2 hours or 3 hours, usually it is seen in the case of cancer or heart attack bypass surgery. So there patient is under anesthesia for more than 3 hours. Now such patients, I have given yoga practices immediately after diagnosis of the disease. So what was the benefit, you know? their respiratory system was functioning properly, cardiovascular system was functioning properly. So when they were given anesthesia, what is the idea of giving anesthesia? Anybody? Non-doctor, non-medico.
पेन सेंसेशन मतलब वो समझ में नहीं आएगा इसलिए
हाँ, तो
पेन फील ही नहीं होगा
पेन फील नहीं होगा. So we use some drugs which block the sensation going to the brain. That is why patient doesn't feel pain and he is made totally unconscious. Okay. Now, 3-4 घंटे, if the operation is lasting for 3-4 hours, we keep on giving little dose of that anesthetic drug. Now, when we finish the operation, anesthetist, what he does, he stops giving the drugs which are making him sleep. And then, when he comes out of anesthesia, how it comes out of anesthesia, when he becomes conscious, when the surgeon tells the patient, doctor, anesthetist, that we have finished the surgery, so he stops giving the anesthetic drug and then he gives the antidote to that drug. So the sleeping effect or hypnotic effect of that drug is eliminated by giving antidote. Now this drug, which is given through the vein, it circulates into the blood, blocks the channels into the brain, and that is how patient becomes unconscious. Now this drug, when it circulates into the circulation, when it comes into the liver, it should be washed out. Till the time it doesn't get washed out, patient doesn't come out of anesthesia. Now some of the gases are given for keeping patient unconscious. Now these gases should be exhaled out by the lungs. Now when we do surgery, we put a tube into the nose and into the lung, and through that we are giving. Now when patient is made unconscious, what is the important thing happening? Anybody?
पेन कम होगा it should be breathe
Or what else? If patient is made unconscious, no messages are sent to the organs of the body. No messages are sent to the lung also. So lung will breathe. Yes or no?
yes
How? If patient is made totally unconscious, the lungs are not breathing. If patient is not breathing. So what we do, we put a tube through the nose and it goes into the trachea and we connect it to the artificial respirator. जो boils apparatus रहता है ना, operation, what we use during operation, surgery. So we give artificial respiration. So the lungs are breathing with the machine. When we finish the operation, when we tell the anesthetist that we have finished the operation, then what he does, he stops giving anesthetic drug, then he gives antidote to the anesthetic drug, and then he removes the tube. When he removes the tube, after that, patient starts breathing on his own. When patient starts breathing on his own, then the respiration becomes normal. But if his lung is not in a good shape, after removing tube, after stopping the anesthetic drug, patient doesn't breathe on his own. Sometimes you must have heard that patient was operated, but he was not breathing. That's why he was put on ventilator. Have you heard this? Why he was put on ventilator? Because he was not breathing. Why he was not breathing? Because his lungs were poor. So if you give him yoga practices before surgery, because usually these patients, they are diagnosed and then the major surgery is decided at least 15 days prior. So they know that after 2 or 3 weeks, they are going to undergo major surgery. So you have got 3 weeks time to give them yogic practices, particularly this Kapalbhati, this all that, so that it improves their lung condition. it improves their cardiac condition. So when they are under operation, unconscious, when they are after surgery is over, their lungs will take up the normal function immediately. They will come out of anesthesia and they will start breathing normally. Because as the time of the surgery increases, it has got bad effect on the body. So lesser the time, better the result. So if you give yoga practices immediately after diagnosis, during active treatment, during surgery, they will fare better. Then third thing, after main treatment is over, when patient is discharged, then if you give post-operatively, the recovery is faster. Otherwise, you must have heard the patient got operated 1 month back and still he is lying down in the bed. He is not making any movement. He is not getting up. Why? Because all the systems, they are not taken up the normal work again. That is why he is having problems. But if he is doing these yoga practices, then his lung system is good, heart is good. So they will come back to normal within short time. So these are the important aspects of the yogic practices in cancer patients. Now, patient can practice yoga under yoga experts' guidance. Patient should not stop the medicines advised to him by the doctor. And thus, yoga and medicine may prove to be mutually complementary. Now, after main treatment is over, the patient is convalescing, means he is recovering. Suppose this patient, he was not given yogic practices before surgery or after immediately diagnosis, and after operation, suppose you go and tell him that you do this practice, that practice, what happens, you know? He says, what, I am already having pain, I have already undergone major surgery, what you are telling me, what effect is going, on the contrary, you give me one injection, I will be happy. Because they have not developed faith in yoga, they don't know the different practices of yoga, they will not practice after surgery. But if you give them yoga practices before surgery, immediately after diagnosis, then they know the importance of the yogic practices. And after operation, when they are in recovery, if you tell them, now you practice this, they will practice it and their recovery will be good. So this is very important. What type of yoga practice you can give, that we'll discuss. So it should be under experts' guidance. Then you should also see which part of the body is affected because of the cancer, what operation has been done, which part of the body has been operated. Accordingly, you have to select the yoga practices. So what is the yogic treatment? First, because I give stress on this again and again, no false assurances should be given. No tall claims should be made. Cancer, don't worry, come and sit here, I will cure it. No. He should be given a moral boost. You can tell the relatives of the patient. Patient you need not tell, but relatives you should tell, see, you know that cancer is not a curable disease, but at least we can make his life comfortable. Whatever days are remaining, we can make it comfortable. That much you can assure to the relatives of the patient. To moral boost to face the consequences or complications arising due to carcinoma. Such patients should be given breathing techniques like pranadharana, kapalbhati, ujjayi. Kapalbhati also, if it is not contraindicated, means if he is having BP and all that, if he is having lung surgery, lung cancer, then abdominal cancer, again you will have to think what type of kapalbhati you can give. If you can give, you can give only simple kapalbhati. That too, initially you should not introduce. Suppose patient is operated and he has just come. So at least 1 month, don't introduce kapalbhati. You can give other things like pranadharana, ujjayi, anulom vilom, omkar, gayatri chanting. And about asanas, again, because this repeatedly I am telling you, because so many times I have seen that patient in enthusiasm by the yoga teacher as well as by the patient himself, they practice asanas without knowing whether they have got secondaries or metastasis, and they'll end up in trouble and then say, oh, I was doing yoga and then I got fracture. And then our faculty is ready to blame. See, I told them not to do anything. They are done and they have got fracture. So this should not happen. So remember, we would not give more emphasis on asanas. You can give such patients some asanas which Sukshma Vyam you can give, and as far as possible, don't ask him to practice any asanas. Non-ambulatory patient, disease acts at physical level, making him unable to perform more activities. So physically he is down, so he is not ready to practice anything. Then he is not ready to practice, so the muscles are becoming stiff. When muscles are becoming stiff, again the movements are not possible or painful. So again, what will say? No, I am getting pain, so I will not practice. So again, this is a vicious circle. And then he tries to get sympathy because he is becoming dependent. So no, I'm not able to do it. I'm not able to do this. I'm getting more pain. So what happens? He tries to get sympathy from the relatives. So okay, don't do anything. I will help you. So that tendency patient develops, and he loses interest in life. Psychosomatic effect leads to poor response to the treatment, and somewhere we have to break that. How it can be broken? So you have to do the counseling, talk to him, give the importance of yoga. That patient was practicing and then he got a better result. So then stiffness is there. Why it is there? Because you are not making movement. So what you can do, you just do simple and you yourself sit there and get it done. So slowly he may develop confidence in you and he may practice. So here you have to, if he has not practiced yoga, immediately after diagnosing and you are coming to treat the patient when he is already operated in non-ambulatory, there you have to go very slow. You have to do a counseling and slowly you have to add some kriyas so that he may be able to do it. There what you will give? Pranadharana, hand and leg stretching, Ardha Halasan. Just in lying down in the bed only, just ask him to raise the leg, do the crocodile poses, Ardha Bhujangasan, light Kapalbhati as per lying down only he can perform Kapalbhati. Just see whether he has got that lung problem or abdomen problem or blood pressure. Then Ujjayi, Kriya Yoga, Anulom Vilom, Omkar, Gayatri and meditation. Meditation will help all the patients of cancer, irrespective of the which part of the body is affected. So don't worry about that. So any question on this cancer? Then we'll go to the next chapter, stress.